my name is India Kilmer. I'm a student in Dr. Thomas's Psychology 2070 class at LSUA. Today I will be attempting to inform you about psychological disorders in children through a question and answer interview with Miss Misty Ryder. Good morning, Miss Ryder. Would you please share with us your educational background and experiences in dealing with psychological disorders in children?
Yes, good morning. I have a master's in clinical psychology, which I received from Northwestern State University. I have worked at a supports and services center, which supports individuals with mental retardation and developmental disorders for the last 15 years. Prior to that, I also worked with much younger children under the age of 18 all the way down to birth for about a year.
Thank you. I have some questions for you. What exactly is a psychological disorder?
A psychological disorder is essentially a mental disorder wherein individuals will display behavioral symptomology and that will typically significantly impact their day-to-day life.
Why don't we just refer to it as mental illness?
One of the number one reasons we don't refer to it as mental illness is because it is not politically correct. We tend to prefer to rely on saying psychological disorders or mental disorders because when you say the word illness, people typically think that it can be cured relatively quickly or with the use of medication, and we know that psychological disorders are not curable.
Would you please share with us some psychological disorders so that we can get an idea of what they may look like?
Sure. Some of the most common psychological disorders that most people are more familiar with would be major depressive disorder, bipolar disorder, schizophrenia. However, in childhood, the most common that people would be familiar with would be attention deficit hyperactivity disorder, which we refer to as ADHD, or the autism spectrums.
Would you share some common statistics on psychological disorders in children?
We see a prevalence rate of about 1 in 5 children having a psychological disorder, which equates to about 10% of the population. Of that 10%, only about 20% are actually diagnosed and treated. For those that are left untreated that require law enforcement or active hospitalization, we see those children, about 70%, having psychological disorders.
When would be a good time to intervene if a disorder is suspected in a child?
The earlier you can intervene, the better, because you can start immediately with some behavioral programming. If parents suspect things, they see some interactions with other children of the similar age, and they see their child acting differently, or if you have teachers reporting or grandparents reporting some odd behaviors, we would recommend that you immediately seek the assistance of your pediatrician. They can then do other testing to determine if you need to in fact see a licensed professional counselor or a psychologist.
Is it a big deal to test and diagnose children with psychological disorders?
It is a big deal for the parents. Many parents do not want their children stigmatized. They also tend to feel guilty or feel like a failure as a parent, thinking they could have done something differently, not realizing that in some cases it's nothing that they've done wrong. It's also a big deal because, again, the sooner you can get to the child and treat the disorder, the much better off that child will be in the long term. As far as actually testing the child for a psychological disorder, it's relatively simple tests that can be done to determine whether or not they have something going on.
What is a DSM-5?
The DSM-5 is the Diagnostic Statistical Manual. It's the 5th edition. If I recall, it came out in the year 2013. It's utilized by psychologists and or psychiatrists or even pediatricians to diagnose mental health issues.
What are some of the causes of psychological disorders in children?
Some of the most common would be genetics. Others would be chemical imbalances within the brain chemistry itself, and then also a traumatizing environmental factor that may trigger something.
What are some common treatments for psychological disorders in children?
Some of the most common treatments would be behavioral therapy, cognitive reasoning therapy, also medication psychotropic usage.
Do children outgrow any of these disorders?
We typically don't like to say anyone outgrows a disorder, because then that again would lead to the fact that it was an illness and not a disorder. Children don't really outgrow. They may mature and learn to better handle and rationalize situations and deal with the symptoms of the disorder. Also, we do see sometimes where the disorder may develop and progress into something different. For example, a child with attention deficit hyperactivity disorder may not necessarily outgrow the symptoms, but instead may develop a bipolar disorder.
Are there any controversial issues on this topic?
There are several controversial issues, of course, one being that we are overdiagnosing our children, we're stigmatizing our children, but probably one of the most well-known controversial issues would be the use of the psychotropic medication to treat childhood disorders. Many experts are saying we're over-medicating our children rather than dealing with the behaviors and teaching them better coping skills.
Thank you for your time, Ms. Ryder. It has certainly been a pleasure. If you would like further information regarding this material, you may refer to these references.